We've developed the Interpret framework to establish some of the fundamentals of working effectively with an interpreter to provide care for limited English proficiency patients. Working effectively with interpreters is a skill that requires practice. As you develop these skills, the partnership with an interpreter can help you not only communicate but also build a strong provider-patient relationship. In this video, you will see specific examples of how you can negotiate each component of the Interpret framework. To begin, introduce yourself to the interpreter and acknowledge their presence. Also, allow time for interpreters to introduce themselves to you and the patient.
Hello, I'm Dr. Quick.
Hi, I'm Cristiano. I am the Portuguese interpreter for this session, and this is Maria. Maria, eu sou intérprete de português para essa sessão, e essa é a doutora Quick.
Nice to meet you, Maria.
Prazer em conhecê-la, Maria.
You may have a seat over here, and Cristiano, how might I facilitate working with you today?
Você pode se sentar ali, e ela está me perguntando como que ela pode ajudar para facilitar a comunicação, e a gente vai conversar um pouquinho antes de começar. Negotiate with the interpreter how long you should speak before you pause. Remember to pause so that the interpreter can interpret. You don't need to stop at every word. Finish your thought, even if it takes 2 or 3 sentences. Trained interpreters will take notes for longer stretches of speech. Dr. Quick, I am a trained interpreter. Everything that is said in this room will be kept confidential. Also, everything said here will be interpreted, so if you engage in sidebar conversations, those will be interpreted as well. I might make a gesture to ask you to slow down or pause between sentences so that I can interpret more accurately. And now I'm going to repeat all of that to the patient in Portuguese.
Thanks.
Maria, eu estava explicando para o doutor que tudo que será dito aqui vai ser mantido confidencial. Treat the patient in a culturally sensitive way. The interpreter is there to interpret what you say. Do not assume the interpreter knows everything about the patient's culture. However, the interpreter can sometimes help you understand that gap. Communication is not just about words. It's about culture, knowledge, about how systems interact, about interpersonal relationships and context.
So, Maria, I understand you're experiencing a lot of pain right now. On a scale from 0 to 10, with 0 being no pain at all and 10 being the worst pain ever, how would you rate your pain?
Maria, eu entendo que você esteja sentindo bastante dor agora, então numa escala de 0 a 10, onde 0 significa dor nenhuma e 10 uma dor insuportável, qual é o nível da sua dor agora?
10, com certeza.
It's 10 for sure.
Wow, it sounds like a lot of pain that you're experiencing right now. Cristiano, do you think Maria's understanding what I'm asking her for?
Nossa, Maria, parece que é muita dor que você está sentindo agora. E ela está me perguntando se você está entendendo o que você perguntou. Doctor, I think I may know what the issue is here. Eu estou dizendo ao doutor que eu acho que eu talvez entenda qual é o problema aqui. Doctor, usually in Brazil, most patients don't classify their pain in a scale of 0 to 10. Então, eu estou dizendo para o doutor que, de forma geral, pacientes brasileiros não entendem essa classificação de dor de 0 a 10. Doctor, is there any other way that you can ask this question? Tem alguma outra forma que ele pode fazer a pergunta?
Yes. Maria, does your pain wake you up at night, or does it interfere with your activities that you try to do every day?
Maria, essa dor faz com que você acorde durante a noite ou interfere com as atividades que você realiza durante o dia?
Sim.
Okay.
Yes. Enable the interpreter to position themselves in the room to best interpret for all parties. If everyone is seated, make sure there's a chair for the interpreter too. And be aware of how changing patient positioning during the encounter might impact the interpreter.
So, Maria, I'm going to sit you up a little bit here.
Maria, eu vou te levantar para que a gente possa conversar. Doctor, I'm just going to move closer here so I can hear you both better.
Great. Is this better for you?
Ela está perguntando se aquela posição é melhor. Yes, that's a better position. Yes. Recognize that interpreting is a complex task, so be mindful about speaking clearly and that it becomes harder for the interpreter to do a successful job when multiple parties are speaking at the same time. You can help the interpreter by making sure that not everyone is speaking at the same time. And remember to pause to allow for interpretation and then wait until the interpreter has finished. To provide accurate interpretation, the interpreter needs to understand what speakers are saying. Moreover, since communication is not only about language, interpreters need to see speakers because of nonverbal cues. Therefore, it's very important for people to speak clearly, to project their voices, to pace themselves, and allow for pauses so that interpretation can be done. Prepare for a longer session. Because everything that is said is interpreted into another language, an appointment may take twice as long as a monolingual one. Because the main mode of interpretation in dialogue settings is consecutive, in which speakers have to pause between sentences to allow interpreters to interpret, participants in a clinical setting should expect the appointments to last much longer than in a monolingual or a single language environment. This impacts all members of the dental team, including those who schedule interpreter-mediated appointments and follow up. Relay your message directly to the patient. Interpreters interpret in the first person, so there's no need to say, ask or tell him or her when addressing the patient. Maintain eye contact with the patient, not the interpreter. And be mindful about speaking clearly. You don't have to slow down or raise your voice. It's about enunciation, not speed. Interpreters will interpret everything you say, including side conversations. It's also not good practice to leave the patient out of the conversation. They might think you are talking about them.
Maria, I see you're allergic to local anesthetic.
Maria, eu vejo que você tem alergia à anestesia.
Sim.
Yes.
What kind of reaction did you have? Did you have trouble breathing or swallowing? Did you go to the hospital?
Que tipo de reação você teve? Você teve dificuldade de respirar, de engolir? Você foi ao hospital?
Aí eu passei muito mal. Meu coração disparou. Eu não gostei da experiência não, mas eu não quero sentir dor.
I felt really, really bad. My heart sped up. I didn't like the experience at all, but I don't want to feel any pain either. Empower your interpreter to manage the communication flow. The interpreter might need to stop you if you're speaking in very long sentences or ask for clarifications.
I don't want you to have pain either, Maria. It was probably not an actual allergic reaction that you had. It was probably a reaction to the epinephrine that is in some of our anesthetics. We can use anesthetics.
Excuse me, doctor. Would you mind just stopping so I can interpret those sentences to the patient? Eu também não quero que você sinta dor, Maria, mas eu acho que não foi uma reação alérgica. Eu acho que a sua reação tem a ver com a epinefrina que está contida em alguns anestésicos. Okay, go on.
Yeah. The epinephrine can cause your heart to race and feel anxious, just like you described. We can use an anesthetic like mepivacaine or prilocaine.
Excuse me, doctor. Então, foi a epinefrina que fez com que o seu coração disparasse, que você sentisse ansiedade, mas a gente pode usar outros tipos de anestésicos, como, por exemplo, eu vou perguntar para o doutor. Can you repeat the names of those two other anesthetics?
Mepivacaine and prilocaine.
Can you spell them for me?
MEPIVACAINE.
Mm-hmm.
And prilocaine is PRILOCAINE.
Thank you. Então, tem outros anestésicos que podemos utilizar, como, por exemplo, a mepivacaína ou a prilocaína.
Yes, and either of those anesthetics should get you numb so you won't feel pain and not have that racing heart.
E qualquer um desses dois anestésicos vai fazer com que, não vai fazer com que o seu coração dispare, vai fazer com que a área fique adormecida e você não vai sentir dor. Trust your trained interpreter to be your language mediator. Do not ask the interpreter to do things outside of their interpretation work. Your interpreter is there to make sure you and the patient can communicate. And with trust, the interpreter can be a valuable member of your team during the patient's appointment. Interpretation, though, does not take place outside of the appointment. So asking the interpreter to do something like call patients in their home to remind them of appointments is outside of their scope of practice. They are there to facilitate communication with a limited English speaker during the visit. We have just taken you through the Interpret framework and demonstrated some of the fundamental skills for effective communication with interpreters and limited English proficiency patients. Remember that this framework is meant to help you begin to develop skills in working with an interpreter. Providing care to limited English proficiency patients extends beyond the patient's care in the operatory. So you will want to also consider how different processes in your clinic can more broadly support patient care for these populations, like scheduling longer visits, establishing mechanisms to remind patients of appointments, and providing ways for the patient to get in touch with you at other times via an interpreter. And remember that working effectively with trained spoken language interpreters can enable you to provide quality care and ultimately increase access to care for limited English proficiency patients.